Welcome to Oncology Data Advisor. Today I have the honor of being joined by Dr. Dhodapkar, who is here to discuss the results of a trial presented at the IMS meeting. Dr. Dhodapkar, thank you so much for coming on today.
It's really a pleasure. So again, my name is Madhav Dhodapkar. I'm professor of hematology, medical oncology at Emory University. And I'm here at the International Myeloma Society meeting in Greece to discuss the results of a clinical trial of Linvoseltamab in multiple myeloma.
Awesome. So for a little bit of background, would you like to tell us a little bit about Linvoseltamab and its mechanism of action?
So Linvoseltamab is essentially a bispecific antibody. What that means is that one end of the antibody binds to tumor cells or myeloma cells through targeting the molecule called BCMA. The other end targets T cells by targeting a molecule called CD3. So it's a CD3 BCMA bispecific antibody. And what that does is brings the tumor cells and the immune cells, which is T cells, close to each other so that the T cells can then kill the tumor cells directly.
Great. So what is the linker MM1 study investigating?
So this trial is basically testing the effects of this specific antibody, this bispecific antibody, in patients with what we call relapsed refractory multiple myeloma that have relapsed following multiple lines of therapy. This is a patient population of unmet needs because, although we've made a lot of progress in treating multiple myeloma with several new kinds of therapies, we know that patients still progress after receiving those therapies, and there's a need for newer agents to treat those patients. And so this is really targeting that patient population with this new class of agents.
Right. So what are the efficacy results from the trial that you're presenting this week?
So we're actually quite excited about the results of this study. This is this study was based on prior studies, and we came down to a dose of 200 milligrams to treat a cohort of patients. This specific presentation describes the results of treating a cohort of patients with that dose of Linvoseltamab. And what we are kind of excited to find is that almost 70% of patients achieve a response following therapy in this setting. It's like 71% achieve what we call a very good partial response, which means it's a significant reduction in the protein levels. And 30% of patients achieve a complete response or more, which means that we can't detect that null protein anymore in blood or urine, or in the bone marrow. And these results, therefore, are actually quite promising because generally there are very high response rates for previously treated patient population like this.
That's really exciting to hear. So were there any notable toxicities or anything unexpected?
Right. So, I think bispecific antibodies, the kind of side effects that we typically think about, one is called cytokine release syndrome. While cytokine release syndrome is expected to some degree to be observed in this with this class of agents, what was unique about this trial was that the incidence of what we call grade 3 cytokine release syndrome or grade 3 CRS was actually very low, just a few patients, and also the incidence of ICANS, so we call immune cell effector associated neurologic syndrome, was also very low. So these two major toxicities typically that we see with bispecifics was low. The main toxicities were still pretty much as expected. We expect some hematologic toxicity with this class of agents, and that was observed, but was very manageable. And then the other adverse event that I think we are observing across all bispecifics right now in this class of drugs is the risk of infections.
Good to know. So what do these results of Linvoseltamab mean for the treatment of multiple myeloma?
So I think these data really, I think, make it, are very hopeful because they suggest that Linvoseltamab is likely to be another BCMA bispecific that could be approved and available for therapy of myeloma patients. This class, there are already 2 other bispecifics against this target already FDA approved. But we expect that this drug would also be available for treating patients because it really has a lot of promise. And there are
Great. So what are the next steps for the linker? And
the next step typically with these things is to actually do a phase 3 trial, which is comparing it with other therapies, which is currently ongoing. We hopefully should have this drug available to patients in the very near future, even before the data from the phase 3 are actually available.
Great, that's very exciting. So thank you so much for coming on today and telling us all about the trial. It's really awesome to hear about.
Thank you for having us.